Design Bugs Out is a programme that the department has put together in direct response to what people have told us they want, what the public and patients have said. We expect clean hospitals, we expect them to be functional, we expect them to be comfortable. It builds confidence, and therefore Design Bugs Out seeks to bring forward the very best ideas in design to meet all those objectives, to design things that actually can get cleaned and their cleanability factors are very high. Secondly, to make life more comfortable for our patients in hospitals. And thirdly, to improve the overall experience and also help staff do their job a deal better, a deal more focused on the patients that we all seek to serve. We will bring forward by March of next year, brand new, designed by some of the best designers in this country. We will make sure the NHS understands the underpinning design qualities of this furniture, how it can help them improve in their work, how it can help them improve in fighting infection, and how it can help them improve the patient experience.
We're running a national competition so that we can get the UK's leading designers to bring their thoughts to bear on this problem. And really what we're aiming to achieve is to develop 5 key solutions that we can then roll out into hospitals up and down the country. The project is actually looking at furniture and equipment, but we understand that this is a systemic problem, and so many of the solutions may be beyond the actual equipment and furniture. So what we're asking designers to do is to actually focus on the physical touch points, but actually think of them in terms of how the experience of staff and patients actually interact in a live way and actually form a service, if you like.
Anything that comes into contact with the patient can become contaminated, particularly if the patient has something like MRSA or particularly Clostridium difficile. And these are things like the commodes they have to use if they can't get to the toilet, chairs they sit on, the trolleys they're transported on. All of these need to be easily cleaned and decontaminated, and their design in the past has tended to be full of joints, nooks and crannies, junctions between metal and plastic. Not the easiest of things, and it is very difficult to remove the spores. The spores of Clostridium difficile can live actually for hundreds of years. They're very resistant. You need to be able to get rid of them.
I think for patients, they need to know that the space has been designed so that it's easily cleaned. And as important as that the space gives the perception that it's been designed to be cleaned, because it gives them confidence that they're in the right space and they're not going to pick up any nasty bugs. And the comfort of our patients and having them have confidence in the service that the NHS is providing is vitally important.
There's a good way of looking at this project. It's probably the most important thing you can do this year, or maybe in your entire career, is to tackle as a designer this issue or issues of this type. This is people's lives we're talking about here. It's not about how pretty the cruet is or what shape the damn car is. It's about life, and it's about saving lives. So I think that's the right agenda. In my book, design is making life better for people. So let's do it, shall we?